Okay, everyone, welcome today. Thank you all for joining us for our annual Global Emergency Medicine Literature Review update. And today we're going to be talking about the Global Emergency Medicine literature from 2017. I am Adam Levine. I'm editor-in-chief of the Global Emergency Medicine Literature Review, which is published annually in Academic Emergency Medicine. And I'm joined by Dr. Torben Becker, our managing editor for the Global Emergency Medicine Literature Review. So for those who haven't heard about us, we are currently in our 12th year of publication in academic emergency medicine. Our mission really is to highlight and disseminate high-quality global emergency medicine research, illustrate best practices, stimulate additional research, because we're academics and we always want to promote additional research, and then, really importantly, further professionalize the field of global emergency medicine. So all of us who live and work in the United States benefit from decades of evidence-based emergency care research in the United States. Much of the world is just starting to gain the benefit of this, and the way we can help accelerate that is by combing the literature, identifying that research which is really high quality, that really should be practice-changing in low and middle-income country settings, and then making that information available in an open access way to all of the emergency care practitioners around the world. And that's really what we try to do each year with the Global Emergency Medicine Literature Review. It's important, even though we use the word review, we are not a systematic review or a meta-analysis, though we now have a spin-off arm which is specifically doing systematic reviews of global emergency care topics, similar to a sort of Cochrane review for global emergency medicine. And they're tackling one systematic review each year right now. So how does our Global Emergency Medicine Literature Review work? Just quickly, I'll go through the methodology of it. So each year we conduct a search in Medline for a combination of emergency medicine and global terms in order to try and identify articles that might be potentially related to global emergency medicine. We also do a hand search of 7 different journals which typically publish a larger than normal amount of global emergency medicine literature, and we look through all of the articles published in those journals each year. Finally, we don't stop with the published literature. We also comb the gray literature because we recognize that there are probably a lot of global emergency medicine research studies that are being conducted by NGOs, by think tanks, by other groups that don't tend to publish. And so we look across a range of different websites each year to identify those research studies from the gray literature and include them in our review as well. So from this comprehensive process of gathering together articles, we'll then go through each of those articles and screen them to make sure they fit into one of the categories of global emergency medicine. And so the categories as we define it are emergency care and resource limited settings, disaster and humanitarian response, and emergency medicine development. If you're interested in what defines those categories, you can go to our website actually, www.gemler.org, where we have all of the information about how we conduct our review each year in our procedure manual, and that includes the clear definitions for each of these different arenas. And then once we screen through articles to identify the ones that truly belong in the category of global emergency medicine, we categorize them as original research articles or systematic reviews. These are the only types of articles we include. We don't include commentaries or letters to the editor or news articles or anything like that. Once we have the list, basically, of all the global emergency medicine articles from that year, we go through and we score all of those articles. And that's a very long process that our reviewers go through. We score them on 5 different areas: clarity, study design, ethics, importance, and impact. And we have a very specific rubric that we use, that our reviewers use to score those articles. So in 2017, we found 17,722 potential articles through our search of the literature. Our screening narrowed it down to 848 articles, which we believe make up the totality of all global emergency medicine research that was published last year. And then we scored all 848, and the top 21 of those were picked as sort of the top sort of practice-changing or most important articles of 2017, which are described in greater detail in our review published in Academic Emergency Medicine, which will also be available on our website this summer. So one of the things we can learn basically from our global emergency medicine literature review is the impressive growth in global emergency medicine research over the years, from when we started doing the review back in 2005 until now. We've seen a huge increase in the number of global emergency medicine articles published each year. And so that's exciting and an important piece of the growth of our field. Also, a number of outside authors have started mining our database, which is open and available on our website, in order to study trends and look at other things that have been developing in the global emergency medicine research arena. So now I'm going to turn it over to Dr. Becker to talk specifically about 3 of our top 21 articles. We don't have time to go through all 21 with you here this morning, but he's going to go through 3 that we think highlight the diversity of research that's being published in the global EM arena.
Thank you. So those are, as you just heard, 3 of our top articles. They are not the 3 top articles. We do not make a rank list, so to say, produce a rank list of within the 21 top articles that we have, because they all score essentially very close to the top. And so this is not a selection based on rank, but a selection based on what we believe might be interesting to the practitioners of global emergency medicine, and something that you should know of or may be able to even use when you're practicing global medicine in the field. The first article looked at the efficacy and effectiveness of an Ebola vaccine during the outbreak, and what it was an open-label cluster randomized ring vaccination trial in Guinea and Sierra Leone, testing the efficacy of a single-dose vaccine in protecting against Ebola, and this was a virus-based candidate vaccine that expresses a surface protein of the Zaire Ebola virus. They employed an interesting methodology in that they identified index cases of Ebola and then tracked down their contacts and the contacts of those contacts, and included those patients in the trial, or those contacts and patients in the trial. Willing participants were either randomized to immediate or to 21-day delayed vaccination. And the results were that in those who did receive the immediate vaccination, 0 cases of Ebola virus disease were noted after 10 days in almost 4,000 vaccinated individuals. Whereas in those who received the delayed vaccination or who were eligible but not vaccinated in the immediate group, there were about 23 cases noted. The vaccine efficacy based on this was 100%, with a confidence interval ranging from 70% to about 100%. Adverse events were common, but they were usually mild. There were primarily headaches, myalgias, so usually essentially side effects that are common with other vaccines as well. There were some significant adverse events. Those included some patients who did contract Ebola virus disease within the first 10 days, even though technically the authors and the safety monitoring board for the study did not consider that a side effect of the vaccine, but it is essentially a failed effect, if you will. And then vaccine-induced fever and anaphylaxis, those were very rare. The total severe adverse events attributed actually to the vaccine itself was a total of 3. This study was included, and we think it's important because it was, at the time, the first efficacy study of the RVSV Ebola vaccine in humans. There has now been a second study just recently published. It showed significant promise in protection from Ebola virus disease. The ring trial methodology, so they're hunting down the contacts and the context of the contacts, may also in itself have helped in slowing down the outbreak. And the study nicely demonstrates how, during times of local system stress, collaborating on a national level, on a local level, is really essential to the success of implementing such a vaccine project. The second study that we've included is a systematic review, and it looks at predictors of mortality in African children suffering from severe malaria. Obviously, malaria is an ongoing major public health challenge, and the authors of this systematic review looked specifically at the pediatric population and those identified as having severe malaria. So they tried to really look at those children where having potential predictors, potential factors that will tell you who is at high risk for death will be particularly helpful. As you can see in the flow diagram, they started with a significant number of articles initially, 600 articles, and were able to narrow it down to about 30 articles that they included in a qualitative analysis. They actually employed some interesting statistical techniques to really perform a high-quality meta-analysis of those data. And this is one of their main results here, the odds ratios for different clinical and laboratory features. Here at the bottom, you can see the ones that had the strongest association with mortality, whereas those up here had not a very strong association. And so this is just making it a little more easy to visualize here and to see. Of the 36 variables that they looked at, both clinical and laboratory in nature, the 5 indicators with the strongest association with mortality in children with severe malaria were renal failure, hypoglycemia, coma, shock, and work of breathing. They called it deep breathing, but essentially this is work of breathing. Whereas those with the least association were impaired consciousness, fever, and severe anemia. And the latter may be particularly interesting because anemia has been a topic that's been discussed. Its role has been discussed at length over decades, indeed, in patients with malaria, particularly in the pediatric population. So we believe that the data from this systematic review is certainly something that may be useful if you're practicing in such a setting with African children with severe malaria, where knowing of what is a warning sign and what is not as much of a warning sign is really important. And I think both are equally important because you want to know the ones that are going to do well, potentially. You want to know the ones that are likely not doing well. And I think the least association is indeed an important finding because some of those, even, for example, impaired consciousness, may traditionally have been considered as a worrisome sign. And in some settings, people may say, well, they don't really look good, should we give up on this care aspect, and so on and so on. And we can tell from this that indeed there is not an association with mortality. And then finally, our last article for today, of the 3 articles that we're presenting, looked at the accuracy of the Brazzolo tape for weight estimation and for as a drug dosing guide. As you know, the Brazzolo tape has been around for some time, was first developed in the 80s in the United States. It is still very widely used around the world. It is probably used in every emergency department in the United States, but also very commonly used in other parts of the world. Over the years, concerns have been raised again and again about the Brazzolo tape underestimating weight in high-income countries and then overestimating weight in low- and middle-income countries. And this systematic review set out to answer just this question and to find out in which countries, in which settings is the Brazzolo tape particularly helpful or maybe not so helpful. They included over 100 studies in their analysis and in different sub-analyses. And as you can see on this graph, the number up here labeled category 3, those are the ones with a high prevalence, countries with a high prevalence of underweight patients. This is a medium, and then category 1 is the low prevalence of underweight patients. And below here, you see at the very bottom the pooled data for all patients. What is striking is that even for the pooled data, the Brazzolo tape is not much better than a coin toss. And particularly in those settings, in those countries where the prevalence of underweight is very high, the Brazzolo tape performed particularly poorly in terms of giving accurate weight estimations. A concerning finding indeed. Of note, in this study, they also had a number of articles included that specifically looked at the use of the Brazzolo tape itself and identified that in those settings where healthcare is provided by clinicians with little training, the Brazzolo tape appears to often even being used inaccurately. Incorrect use may contribute to those inaccurate estimations. So in conclusion, this systematic review included data from about almost 100 studies. Almost half of the weight estimates were more than 10% off the mark. And they do identify, and I do think this paper is worth reading in full text, they do identify some newer methodologies which incorporate both length and a body habitus estimate to essentially derive more accurate assessments of weight and use this for drug dosing guidance as well among diverse patient populations. Of a particular note, I think an interesting finding was that one of the most accurate weight estimations was actually parental estimate. That was demonstrated throughout a number of studies included in the systematic review, that this appeared to outperform any type of tape or other estimate guide throughout all studies included in this systematic review, and certainly a finding that I think is worth noting.
Great. Well, we'd like to thank you all again for attending, and it is our pleasure to bring the Global Emergency Medicine Literature Review to you each year. Our review is based on the hard work of about 40 reviewers and editors from around the world who volunteer their time to make this happen. It's about 10,000 hours of total work probably to put this review together each year. And we are always each year accepting applications for new reviewers. And so if it's something that you're interested in, you can go to our website. You can apply now to become a new reviewer for the 2018 Global Emergency Medicine Literature Review. So thank you, and we'll take a couple questions now before our time is up.
This is working. So, Adrian Tendall from University of Florida. So, this is a brilliant job, actually. But, and I've seen, obviously, the volume of literature across the world really growing. But is there a sense, I came in a little bit late, is there a sense of the emerging areas of focus in the literature? And I say that from the perspective that, you know, two of the articles you presented were infectious diseases based, right? But we're seeing across the world a shift from communicable to non-communicable diseases. And obviously, in emergency medicine, there is a gap in resources, which we typically don't see in the United States. And so that oftentimes precipitates a type of research or focus that typically focuses on that gap, but also the changing paradigm that we're actually seeing globally. So are you seeing, what are the patterns of, you know, focus that you're seeing, and are there sort of emerging areas that perhaps you might have been seeing between year to year?
Yeah, absolutely. And we discuss it in greater detail in the article that we publish each year in Academic Emergency Medicine, not just the individual articles, but the trends that we're seeing. Certainly, we're still seeing about almost 2/3 of our articles are emergency care in resource-limited settings, so as opposed to disaster humanitarian articles or emergency medicine development articles. And of those emergency care and resource-limited settings, the majority, perhaps up to 2/3, are infectious disease related. And so we're still not seeing the bulk of injury research, though it's growing, and the bulk of non-communicable disease research that we really need in these settings in order to catch up with the type of disease burden that we're seeing around the world. I think that's definitely true. We're also starting to see a slight trend towards better quality research, more intervention studies, better prospective observational studies as opposed to the simple descriptive studies that we often saw more of in the past. But still, it's a slow move in that direction.
I think one, in addition to seeing a kind of a slow increase in the number of articles that are beyond the traditional realm of infectious diseases, and particularly pediatric infectious diseases, also is, and beyond the spikes that we see along with kind of seasonal variation almost, be it Ebola, be it Zika, and so on. I think just the fact that we see the number of articles rise every year speaks to the overall process of global emergency medicine and global acute care medicine maturing and more research being done in this field. We are employing a few techniques to make sure that this is not just a change in how PubMed is indexing articles and so on. And so far, for the last couple of years, the rise in articles that we've seen seems to be a true rise in the number of articles published in the field and not just a change in how reporting or indexing is being done.
All right. Okay, well, I think we'll conclude. This is, again, a huge process that we do each year Please continue to tell academic emergency medicine that this is something that's important to you and that global emergency medicine literature is something that they should be covering and they should be thinking about in our society's journal. So thank you, everybody.